This interview is with Dr. Vidyanath. As a teacher, how do you feel that Ayurveda can be communicated to UG and PG scholars and then to the public effectively, sir?
So, thank you very much, Dr. Krishnamurthy garu. And I feel that as a teacher, I am working in government Ayurvedic colleges, all the three colleges of Andhra Pradesh and Telangana. For the past 18-19 years, I am in the teaching line. And I have observed the pulse of these students, and when they are entering into these Ayurvedic colleges and having a specific mind setup, and they are going to become doctors after joining in the B.A.M.S course. And once they have not got the admission in the medical college, most of the students are joining as a Ayurvedic secondary option. Okay, and in such circumstances, they are having this okay, this is also a medical college, and after having this similar type of this syllabus curriculum, 5.5 years, and afterwards they are going to become doctors. But the teacher of the first year, students, whoever is dealing, should mold those students in such a way that they should inculcate the certain ideas and the concepts of this Ayurveda, and how the Ayurvedic science will be useful for this public as well as this needy patients, and how this system is effectively working. And these ideas should be inculcated in the young minds, and for which a teacher also should take this minimum introductory classes regarding the total system, and also give some certain sort of this confidential levels in their minds. Otherwise, at times many a number of these students may find some sort of difficulty in understanding this Ayurvedic terminology, and at times they may leave the course also. And for which an experienced teacher should give the students as well as added advantage, and what are the opportunities which they are going to get. And there are many a number of fields are waiting for these young doctors to get the opportunities, and as a teacher they are having every opportunity nowadays, because when we are doing our this graduation level, and there are only few colleges are there. As on date, you see in Karnataka only more than 60 colleges are there, and many a number of opportunities are waiting for the young doctors. And in Maharashtra more than 60 colleges are there, and in other states also number of these opportunities to be a good teacher. And when he is going to become a good teacher means if he is having understand the concepts very well, and the same is going to be communicated for the next generation. Otherwise, if he is unable to understand, if he is not having the faith towards the concepts as well as system, and they are not in a position to propagate the merits of this Ayurvedic system to the next generation. For which, as a teacher, I feel that it is a mandatory to inculcate the habit of this knowing this science and knowing the merits of this Ayurvedic system, and he should be in a position to practice Ayurveda. So that's why, as a teacher, the concepts should be showed in the minds of the young students and young doctors, so that the aim of the teacher may be fulfilled. Otherwise, it is not possible to get the expected results.
Sir, how it can be communicated into the public?
Though we are having limitations in our system of medicine, and also we are having the positive attitude and positive result-oriented therapeutic procedures are lying with our system. And nowadays WHO is also recognized this AYUSH systems as alternative systems of medicine in such circumstances, and we are this is the time to show the potentialities of our system of medicine, and we should know the limitations. And if we are having the confidential levels, and we are in a position to know the techniques and these potentialities of Ayurveda, then naturally we can take this what you call merits to this grassroots level and also get the maximum beneficial results with our limited therapeutic procedures. And for example, we are having a very good therapeutic techniques in the area of these neurological disorders, skin conditions, liver disorders, and where the allopathic system fails, for which if you are having this what you call some merits, and if you know the techniques, naturally you will be highlighted, and also the system will be highlighted, and every doctor will be first if he practices Ayurveda. And also one more area, UTTARA is there, and KSHARASUTRA is the another area where a number of these patients are getting benefited. If you go to this All India Institute of Medical Sciences, there government has given the opportunity to establish this KSHARASUTRA clinic at A.M.S, New Delhi, and the surgeons related to anal-rectal disorders, they used to refer the cases whenever a patient is suffering from this nano, and first the patient is to be referred to this KSHARASUTRA center instead of going for this surgery. That's why they also have identified and recognized the potentialities of this Ayurvedic system of medicine, and once they have identified, they are referring, and they are giving utmost better treatment instead of going for surgery, and which is also available in Ayurvedic system of medicine, and the same may be propagated into the grassroots level, and also other government sector and many state governments also should know the potentialities and also can be implemented other these medical these institutions also, so that everybody will be benefited.
Do you feel that application of fundamental principles is a must in every Panchakarma therapy, and compromise of principles can be made?
Yeah, so Charaka has clearly stated that one has to follow the principles, and if you can follow the principles, basic principles, and how to conduct these therapeutic procedures, and if you cannot follow, or if you might have neglected those principles, naturally the physician is going to get some sort of this complications, hazards, and the complications of Panchakarma may be because of the mistakes done by the physician due at times with the patient, and also the not following that schedule also. So that's why it's very much essential or important to follow the principles of these therapeutic procedures which have been mentioned by our acharyas, and also acharyas has given the liberty to the physicians, and due at times there is no need of sticking on the principles also. At times according to the need of the hour, we can mold ourselves, and we can select, or we can this what you call deviate the principles also, because if time may not permit. That's why he has also given the this alternative schedule, instead of going for this SNEHAPANA for 7 days, 5 days, or 3 days, this what you call Sajjo Sneha. And according to the need, initially we are supposed to stick on to the principles. If requires, deviation is being acceptable as per the this verdict of this acharyas.
How to bring to practice of Ayurveda medicines in public health care?
It is a fact that 80% of this rural public is still depending on the indigenous system of medicine, and though the statistics is telling that this Ayurveda, the allopathic system of medicine is globally popularized, that it is not true, because in China you see that traditional system of medicine is still in vogue, and in many number of this rural public is getting benefited with the indigenous system of medicines. That's why if the practitioners or these medical officers who are working in the dispensaries and grassroots level, still there is a necessity to show the results of this our medicines, or this what you call the herbs available in and around the areas, and also give the this information about the herbs which are useful for the medicinal properties, so that in the school level also, if you can incorporate this the medicinal plants and its utility in the children also can able to understand the importance of these medicinal plants, and they will grow the this what you call this cultivate these plants, medicinal plants, and also can be benefited by utilizing the plants and herbs available in the kitchen or in and around our garden. And this information is to be passed on to the general public by means of this what you call this conducting some special camps, distributing some pamphlets related to this information which is having this medicinal plants and their properties, and what are the simple recipes, and which are giving very good this effective results. Due at times the doctor may not be available in many number of these remote corner villages, and even though the doctor is available, and it is not easy to approach the doctor at that particular point of time, if the public and these children and also the persons living in the house, if they can able to know the minimum basic knowledge of these medicinal plants and the herbs and their medicinal properties, and definitely that information is very much helpful to the general public and the persons who are affecting with these conditions. So and this is definitely we are supposed to take the information to the grassroots level, so that it will be helpful to the public and needy people.
Being a author of more than 16 books, what do you advise the Ayurvedic fraternity to popularize Ayurvedic knowledge among the people?
Yeah. So I have written 16 books in English and 2 books in Telugu medium, and I cannot be considered me as an author because I am a translator. So that means I cannot be stamped as marked as an author. What I feel is when I am doing this post-graduation and also after completion of my post-graduation level also, and I feel that my area of interest is Panchakarma, and I feel that this Panchakarma is the potential area and which is able to serve this needy people, and many a number of these disease conditions will be definitely managed by means of Panchakarma therapeutic procedures. And when I am working as a medical officer also, I feel that there is some lacuna is having in this area, and how it should be cope up. And at that time I have approached my authorities and superintendent other this government officials, and they have given the opportunity to go for this special training in Panchakarma at International Institute of Ayurveda, Coimbatore, and that is the turning point in my life where I have learned a lot regarding these various therapeutic techniques, how they are to be conducted, and what is the time schedule, and how they are preparing this what you call the therapies, and what is the actual this material to be taken. And by the time I have this known all these instruments and equipment available in and around the area, and due at times this equipment is not available in many number of these places, for which I have tried to make it is available how it should be, and I have gathered the information regarding this equipment and instruments, and what number of this what you call this technicians are required for each and every therapeutic procedure, and how long it should be conducted. All the information has been gathered through that institution, and at that particular point of time I'm having some what you call a doubt how it should be reached to the practitioners as well as students. And then I thought to write a book on Panchakarma. I started writing from 1996 to 98, 99, and my first book was published in the year 2000, actually 2nd of October. That was the book release date, and it has become a a popular book throughout this country. Why? Because that was the first book which was translated into English. Previously, the book which can be considered as the Bhagavad Gita of Ayurveda, written by Dr. Haridas Kasturi, H.S. Kasturiji, that was this base for my this translation also. And I have taken some information from that book, and also my experiences when I was getting training at this Coimbatore, and I have observed each and every step of various therapeutic procedures, and the same procedure is to be adopted by each and every physician as well as the student. That is my motto, and hence I started writing books from that day onwards, and it was published in the year 2000. And in the methodology of presentation is also should be palatable to the students, and that's why most of my books, almost 90% of my books, are in the pictorial form and illustrated one, and that should be eye-catching, and the students who are even though unaware of this that particular term, because of by seeing that picture itself, he can able to remember the name of the Sanskrit term as well as this what it is also can be known. So in this is the basic idea of coming out with this Ayurvedic books, and my wish, it is not it's not being considered as authorship, but I may be called as a translator, because the information available in other languages should reach to the students as well as the teachers. It's a language which I have been communicated in English. That's the only this particular thing what I have done. But my intention is Ayurveda should reach to the needy portions. That means students should first understand, teachers should understand, and through this the translations also. Do at times these translations may be giving some sort of this contradiction and confusion also. That should not be happened, what I mean to say is. So once you have understand the subject knowledge properly, the same what has been this what you call is delineated in the classics should be translated properly, and then it should be communicated to the next generation.
Sir, in government level and in institution level, what developments are needed to popularize Ayurveda? Whether the recent steps are encouraging, or what way it is being drained?
So this is the thing one has to think about, whether the government is encouraging our this indigenous system of medicine or not. And after formation of this present BJP government at central level, it is giving a very good encouragement for Ayurvedic system of medicine and also AYUSH systems of medicine. But it is not happening with the other state governments. State governments also come forward, and how the central government is giving this top priority to the this what you call this AYUSH systems of medicines, and what is the potentiality of these systems of medicine also should be known by the state governments, and the same encouragement is to be given to this state government these institutions, that is colleges as well as the dispensaries also. Do at times what is happening in state government's mind is how best they are doing to their service to the public is also is a question mark, because the state governments and the chief ministers of some of the states are also having the idea that many a number of these AYUSH systems of doctors are not properly this what you call this doing justification or doing this proper service to the public. So this sort of negative impression should be wiped off from the minds of this state governments, and for which the doctors also should they show their potentiality and where the area of this this what you call this better result result-oriented therapies are to be shown to the government, and so that we can grab the maximum funds from the government, and also can establish well-established this what you call this government hospitals. And whereas you go to Kerala and other Karnataka, some of the other southern states, we can see this what the hospitals of Ayurveda are similar to this corporate hospitals of the allopathic system of medicine, but whereas it is not happening in other states. So the doctors as well as the students also should come forward, and the research persons also should come forward, and this is our contribution, and this is the area where we can able to serve, and we can also what you call this get the revenue from this what you call this medical tourism, and for which the government of Kerala is also encouraging for medical tourism. Similarly, the government is also having such an idea, okay, if we can encourage these AYUSH systems of medicine, not only getting this what you call as a benefit to the public and also service, and simultaneously the government is also getting the returns by means of this tourism. So we should this project ourselves and also be recognized ourselves in this government level. And moreover, another this second point regarding your question, whether the council, this is the apex body, CCIM. What are the reforms so far they have taken, and what they are going to take may not be this helpful for the this what you call development of Ayurveda, because by changing this what you call syllabus and reducing this schedule of this 1.5 year to 1 year, and also making certain changes, the semester system, this also is not good, because this is what you call the subject oriented teaching is one aspect, and Samhita oriented teaching is one aspect, and as on date it is not possible to go for this Samhita orientation. But whenever you are dealing with the subject of the Samhita, you should not learn the subject as a piecemeal. Once you start reading Samhita, which is in the syllabus, Charaka Samhita full textbook is in this what you call the syllabus, and if you can able to read the Samhita at the second semester and third semester, or otherwise second year or third year, and he will be having a clear-cut idea about the original concepts of our acharyas. Otherwise, whenever any this what you call subject-oriented studies means you are going to get this what you call information at the particular point, and it is a piecemeal study, and you cannot got the actual orientation of this acharya as well as the commentator also. And once whatever is telling by our acharyas is having a specific this what you call this intention and this idea also, and the information given in the previous as well as the afterwards also he is having a interlinked, and unless and until you cannot understand the total this what you call this concept, you cannot get the full-fledged information. That's why Samhita orientation is to be continued. We should not neglect this Ayurveda Samhitas, Charaka Samhita, Shushu Samhita and Ashtanga Hridaya. Somebody is feeling that what is the necessity of repetition? That is not true. Repetition is the word, you should not use that word repetition, and the orientation, and this ultimately what I mean to say is the authentic textbooks of Ayurveda are only two: Charaka Samhita and Shushu Samhita, doubtlessly. And Ashtanga Hridaya, though it attains the status of this Bruhatrayi, and it is also can be considered as a compilation work. And whatever the books you are seeing as on date, medieval works and latest works, these are all the this what you call this information which has been gathered from this original text only. take it guarantee. And there is no need of reading almost these books. But what is the necessity of reading Ashtanga Hridaya is, if anybody is unable to grasp this what you call information from the large voluminous works, Vagbhata in the sensory itself, he feels this is the acute necessity that this abridged and small textbooks are very much essential to the mediocre students, for which he has gathered the information and summarized the textbook and given this information in this what you call small sloka form. But he has, though he is having the clear-cut idea, whatever the information is necessary to this present this day scholars, he has come up with small abridged comprise these textbooks. That's why in the present days it is very much essential to read Samhita as a whole and understand the principles, and so that the scholars can understand, the teachers has to give the proper information to the students, and they will be having very good skills to develop this system of medicine by knowing the original concepts, and so that Ayurvedic system will be flourished and it will be benefited to the needy public.
Thank you, sir. Thank you for your valuable thoughts and suggestions.